Like we always say, you can follow us on our YouTube channel, the Epi Hour series, in case you miss out on any of our programs. And the recordings will be posted online for anyone who is interested in the recordings. So today's webinar focus is on face masks and COVID-19 recommendations from the Gambia Standards Bureau. You may all be aware that the Gambia has now made the mandatory use of face masks in the country. And that being the case, we feel that it is very important for the general public and of course us health professionals who are communicating health information to know what standards are in place with regards to the use of face masks. So my co-host is Mr. Se Omar Silla. Se is a lecturer with the Gambia College. He is no stranger to in the public health cadre. You should have been following all his postings with shall we tell the president, COVID-19 things fall apart. These are things that he is very much passionate about, and he is here with me. Hopefully he will take us through the situation reports. So, Omar.
Yes, so Lum, thank you very much.
You can take over from now.
All right, so yeah, so on the situation report, we're seeing some interesting highlights coming. As far as Gambia's case is concerned, we're seeing we are troubled with doubling times on our epic curve. Now we are seeing exponential increase in number of cases being registered just within this sub period in in 14, in 15, 16, 19, and we are now enjoying some 20 and 20 plus. So on the CBS report, 24 cases registered, which is actually the highest, and we've seen daily when cases are registered, we're seeing some shift also in a higher number of case registration. So actually there's some sense of indicators of disease peaking going up very high, and we do not know when there's no suggestions perhaps when this is actually going to peak in this country, because today we know that mandatory use of face masks is what is being pronounced in the public, and there is deviance. And our testing capacity and power, I think there is a need for adjustment on that, because now we are seeing on the CDC report and highlights 149 new laboratory test results being received from both MRC and the National Public Health Laboratory. So we have in the MRC and the National Public Health Laboratory, I think there's a need for some adjustment on the testing capacity, because now we have these two institutions that can actually join together and give us more testing power. Next. Bloom, next slide. Hello? All right, next slide, please. All right, so yeah, so in quarantine, we're seeing more and more people being admitted to quarantine. I think there's a flight today coming up, I think something like that. So we're seeing so much people coming to quarantine with the influx of flights into the country, in the inbound of flights. Possibly we'll be reaching 1,000 being admitted in quarantine facilities soon. So do we have the capacity to keep quarantining is one thing, but do we also have what it takes to keep all these people in quarantine is another. So I think there's a need for, we've been singing that as a national anthem, sustainability in quarantine, and there are no indicators for any ways of or alternatives being suggested by anybody within the Ministry of Health. So I think there's a problem, and we need to adjust on that quickly. Next slide. Yes, some challenges. These challenges also being some national anthem on the CDC report. We've been seeing them, over a long period of time, and nothing is done about it. The case of the intermittent power outrage has been reported previously for more than 10 sit reps. Now you're seeing it coming up, and nothing is done about it. I think the matter of just buying one solar panel and put it at the incident command for the communication to continue shouldn't be a problem as far as responsible response efforts are concerned in the country. So there are existence or indicators of community transmission. We're seeing some heterogeneous transmission in the community, and we're seeing now our healthcare settings are losing grip because we be informed that about 10 doctors, 12 nurses, 7 other people working in the healthcare settings actually been infected with the virus. So we have a problem not only in the community, but we have a problem in the health facilities. Now, Sarab clinic is a problem. AfricMed is a problem. Rather, Medicare is a problem. EFSTH is a problem. So I think what is needed now should be some ring testing versus ring fencing. And this is what the focus should be as far as epidemiology is concerned. Next slide. Yeah, so the occurrence of COVID-19 among healthcare workers, and that's why I said the game is still on. 60 minutes gone into the second half. COVID-19 1, Gambia 0. The coach resigned. Today we have a new coach. We have all trust and hope in the coach to actually take us along. Because we've seen quarantine facilities, the response, the cost borne there is prohibitive. This is mentioned in more than 20 CITREPs, and still we are seeing it being mentioned. That means nothing is done about it, which is actually frustrating the response power. Next slide. So stringent lockdown measures, I think the litmus test today will tell us that lockdown measures wouldn't work again in this country because the public is defiant, and we will have a problem. Well, this would be one of the best public health measures at this time, but unfortunately we have misused the lockdown measures. These restrictive measures should have been quite prescribed, at moments that are needed based on epidemiological evidences. Now the public is defiant. There is too much of disinformation in the public space. Nobody's trusting anybody, so that's a problem. I know it's a very good recommendation to make, but will it work to actually slow the speed of transmission and amplification in the community? It's another problem. Next. IPC measures, is evident that there is, some loose adherence to IPC in our public facilities. We're seeing doctors, nurses, all actually been infected. So I think there's a need for some adjustments on that, and I'm loving the statement on the recommendations of the CITREP. The confirmed cases also who are at large, I think there's a problem, and though that alone is an indicator for some heterogeneous community transmission. And we've seen now that we're losing the grip against local transmission. Actually, cases coming now are not traceable, which are very much indicators of sustained community transmission. And we will not be able to perhaps do well when the transmission classification moves into sustained community transmission. Testing is needed. It should be mandatory for all health workers at this moment to do testing. We've seen indicators that are very much crazy as far as the transmission is concerned for COVID-19. Health workers must also continue to observe some preventive measures on the donning and everything. This is important. Masking is also important, and that's why today we have Ibrahim Ajalo, the Director of Standardization at the Gambia Standards Bureau, to take us through what they have for us as far as mask usage is concerned in this country. In uninterrupted power supply, this had been mentioned more than 100 times on the CITREP. I think nothing is done. It will be ashamed to have this thing mentioned in the CITREP again if the authorities are not taking care. Thank you very much. Back to you.
Thank you very much, Mr. Omar Silla, for that brilliant presentation of the situation report. I think as we can all see, there are definitely challenges with regards to our response effort in this country. And it is a collective responsibility, a national duty on all Gambians to ensure that our response efforts are working in the right direction. Next, we would have Mr. Ibrahim Ajalo, who is the Director of Standardization at the Gambia Standards Bureau. For those of you who do not know Ibrahim Ajalo, we fondly called him ESO when we were at the School of Public Health. ESO holds a higher national diploma in public health from the Gambia College School of Public Health. He also has a diploma in computer engineering from Cross Communication. He holds a BSc in Public and Environmental Health and BSc minor in Computer Science from the University of the Gambia. Ibrahim also backed an MSc degree in Water Supply and Environmental Sanitation from the Kwame Nkrumah University of Science and Technology in Kumasi, Ghana. He worked as a public health officer at Soma District Hospital, senior public health officer and deputy program manager, environmental health unit, and program manager, vector control unit under the auspices of the Directorate of Public Health Services, Ministry of Health. So from here, you can see that Ibrahim is a very experienced and was a public health professional. And this is the spirit of public health. Wherever we find ourselves, we see ourselves as family. And we are very proud that Ibrahim is heading a directorate under the Gambia Standards Bureau. So Ibrahim, we would welcome you to the program once again and give you the opportunity to do your presentation.
Thank you very much, Mr. Lu, and good afternoon, everyone. As you rightly said, my name is Ibrahim Jallo, speaking to you from the Gambia Standards Bureau. I think the other introductions he has done, and thank you so much for that. And thank you very much, the EPI Hour team, for the opportunity to share the standards that has been developed by the Bureau to the other health officers. I know some engagements has been taking place, but not as this much. So thank you very much for the opportunity, and thank you, my host. Thank you very much. The team, as he said, is face masks and COVID-19, recommendations from the Gambia Standards Bureau. Next slide. The Gambia Standards Bureau developed a standard. The standard is called Barrier Masks. It's GAMS 24, 2020. And is guide to minimum requirements, methods of testing, making, and use of the mask. So I hereby start my presentation. Mr. Lum, let's move. First, the presentation outline. For some of you who does not know what the Standard Bureau is, I just want to give a brief overview of what the Gambia Standards Bureau is, and followed by a definition of a standard. I know we all know what standards are, but it's good we remind ourselves shortly before I enter to the content of the barrier mark standard. And from there, I can also share some of the activities that the Bureau is doing related to COVID-19 and some standards that we have related to COVID-19. Then I'll conclude and give some recommendations. An overview. As you may all know, the Gambia Standards Bureau is a government department, is a parastatal, an agency under the Ministry of Trade, and it was established by an Act of Parliament in 2010 to standardize systems, products, and services produced or consumed in the country and provide metrology, calibration, and conformity assessment services. And the conformity assessment services that we do here include inspection, testing, and certification. Probably in a subsequent slide, I will explain more what we mean by testing, inspection, and certification in relation to the marks. The goal of the Bureau is to standardize methods and products produced or consumed in the Gambia and for connected matters. So basically, all products that are either produced or consumed in this country, we are mandated to develop standards for that. The objectives of the Bureau is one, to establish and promulgate standards for imported and locally produced goods, to promote standardization, conformity assessment, and metrology. Though there are two kinds of metrologies, you have the legal metrology part, which may not be with the Bureau, but the other components of metrology are all with the Gambia Standards Bureau. We also promote industrial efficiency and development. We promote standards in public and industrial welfare, health, and safety, and also promote information dissemination on standards, meaning the standards that we develop is also part of the responsibility of the Bureau to inform the general public of the existence of those standards so that anybody that is in need of a standard can come and access the standard for use. Our key functions is to define, prepare, publish, modify, or amend standards, and also to promote training and research. Standard development is basically research. Wherever you see standard development is research. Key experts in the team or topic area of the standards will come together, conduct research, and finally reach consensus on a particular agreement, which may be called the standard. So this is why sometimes, even internationally, development of one standard could even last for more than a year if you are starting the standard from scratch. Sometimes it can even go beyond ISO standards. Sometimes they go up to 3 years or so. So development of standard is all research. Examination and testing of goods processes in conformity with standards is also the other function that we do. We also inspect goods and certified or otherwise in conformity with the standards. Right now we have one product that we are certifying, and we're working on a scheme to broaden the certification scheme. But right now we have certification for packaged bottled water. So we're moving for more certification services. Immediately after the COVID, you roll them out, and then you get you all informed accordingly. And we also have specified certified TGSB, specified TGSB certification mark, and among which are some of the ones that were supposed to be used for these marks, and keep and maintain national primary measurement standards. It's also part of our functions, even though it is a challenge right now in maintaining primary measurement standards. If I may just shed a little light on that, here in the Gambia, the issue we have with measurements mainly is we do this kind of, if you go to the markets, what they say SAM, what the eyes can tell you. For example, if you should go to a farm, let's say a woman garden producing tomatoes, you ask them, what is your production per year? They cannot tell you because they just tell you it's 1 bucket, 1 pan or so. And in that, they are easily cheated because somebody can pack more in a particular pan of the same size than the other person. So we actually encouraging most of these things to go into using measurement devices like weights in kilograms and so on, so that it can help producers and also can minimize cheating in the market. Next slide. Yes, so that was a very, very brief about the Bureau, an overview of the Bureau. The Bureau does a far lot more. I think probably after the COVID, we will organize more sessions for the Ministry of Health to orient them more about the work of the Bureau. I think you will definitely need some of the services of the Bureau. Now that we are heading to the standard itself, I think it's important we remind ourselves what a standard is. A standard is a document. It has to be documented. Anyone that comes can have access to the document and read the content of the document and be able to do exactly what the document states. So it should be a document that provides requirements, specification, guidelines, or characteristics that can be used consistently to ensure that material, product, processes, and services are fit for their purpose. And a supporting definition can be a document designed to be used as a rule, guideline, or definition. It is a consensus built reputable way of doing things. So if something is a standard, it's called a standard, then obviously its utilization should be consistent. If you occupied or if you are doing something in accordance to a standard, whether you are there or not, anybody who have access to the standard should be able to do the same way that you did it. So that's what, those are some of the key features of a standard. The standard must be consistent, and it has to be a document, and it should be based on consensus, and definitely it should, in other way, it's just a repeatable way of doing something. Now we move to the standard proper. Here, I'm just narrowing myself to some key components that are extracted from the standard, which I feel will be useful. The standard is a lot more, and the beauty is the Gambia Standards Bureau, usually these standards are for sale. Standards are not for free anywhere because it is very expensive to develop standards. However, as the Gambia Standards Bureau's contribution to the COVID-19 pandemic, this standard has been produced and it is distributed at no cost. So anybody that needs the standard, just walk to the Bureau and we can give you a copy and you can use it in relation to COVID-19. The scope of the standard, next slide, please. The scope of the standard is a barrier marks which is intended for use only by healthy people, meaning the standard cannot be used by people that are already presenting clinical symptoms or symptoms very similar to that of COVID-19, and cannot also be used by people that are already in contact with people with such symptoms. For example, those people in quarantine cannot be using this kind of masks because they are contacts. And some of the other people that are already manifesting symptoms can also not use this particular mask as a protective mean. So you have to be a healthy person in order to use this mask. It constitutes a protective barrier against possible penetration of viruses in the user's mouth, nose area, and from a nearby person. We all know these fabrics, the level of protection that they offer or that they produce against viruses is minimal. But using the mask can definitely help a lot, especially for people. If everybody is using the mask, definitely the use of a mask will be far better than not using a mask, and it will definitely minimize the risk of contracting the disease. Use of the mask is envisaged, for example, people leaving their homes, going to a workplace, going to market, going to visit maybe a friend, just going to do normal, routine, daily activities. Next slide. So the content of this standard, some of it you may not see in the presentation, is the document specifies the minimum requirements for the manufacture, design, and performance of the barrier marks, and also the testing methods for the barrier marks, which may be reusable, intended to reduce the risk of general transmission of the infection. So if somebody is a tailor, this standard can tell you how to do your cuttings in order to produce a good mask. If you are a user, it can tell you how can you use the mask in order to protect yourself. And some of those ones will be found in the subsequent slides. So the document does not apply to filtering half masks used as respiratory protective devices against particles and not a medical mask. Meaning, if you are working in an environment which is exposed to high dust, you are not using this mask as a substitute. And if you are also a clinician at the healthcare facilities, this mask is not offering you the total number of protection that you desire. So this is not for medical use, and it's not for other purposes where you need more sophisticated masks. Next slide. There are some key important things to note. One, the barrier mask is not subjected to conformity assessment by notified bodies or laboratories. Its design is in accordance with accepted best practice, and production quality control remains the manufacturer's sole responsibility. Second, the manufacturer is permitted to conduct verification and validation tests with its enterprise or in collaboration with a test laboratory that has the appropriate means of testing. So the manufacturer, if you want to do a test, that means you're going to test it against the specifications of the standard that are clearly spelled out. Next. The third point here is we drew attention to the fact that the barrier marks will have maximum effectiveness if it is worn in direct contact with the bare skin. Not pointing fingers though, but some of our sisters who do niqab, it's not very much advisable to put your niqab and then you put the marks on top of it, or you have other things under the marks. So the marks definitely be with direct skin in order to produce the necessary protection that it desires, because a mask, one, is considered contaminated. So if you're mixing it with your clothes and other things, then probably it is doing you more harm than even the good that you are looking for. A warning that we have is the barrier mask does not absolutely exonerate the user from application of protective measures and social distancing measures, which are essential. If you are wearing this particular mask, that does not give you the license or the guarantee that, okay, I must not follow any social distancing rules, I must neglect hand washing practices, I can go into crowds. No, the mask is not giving you that license. So the mask is an additional measure to this. So meaning with or without the mask, you should still observe all COVID-19 rules as specified by the health authorities. Next slide. This is a picture. It may not be very clear. A barrier mask covers the nose, mouth, and chin, meaning the barrier mask should cover the nose, equally it should cover the chin. However, we've been seeing a lot of masks along the streets here. Once they cover the nose and part of the mouth, sometimes they cover the mouth, they don't cover the chin. Or some people will even drop it, it will only cover the mouth and the chin and leave the nose open. So a good barrier mask should cover both the nose, the mouth, and the chin. That's what the standard is saying. Next slide. This is the markings or information instructions. This we have not seen in almost 90% or more than 90% of the producers of the face masks do. When you make a mask, whether it's good or bad, how do we trace the mask? Either in the packaging material, which most of them don't have in proper packaging material. How do you actually trace the marks? Trace the source of the marks. So the marks should actually either in the packaging or so should have the name, trademark, or any other means of identification of the manufacturer or supplier. The number of the document and via wording, that's the barrier marks, it should clearly state that this is a barrier mask, not a medical mask, not an N95 mask. And the recommended period for use of the mask should be specified. If you look at the standard, it's saying you cannot use the mask for more than 4 hours, but also it depends on the type of material that you use. If you are using materials that has a lot of nylon in them, we know how tight it could be. The porosity is very low, and even the breathing becomes very difficult. So in no time, you are hot, you are irritated, and you are tempted to remove it. So the recommended period for use of the mask should really be stipulated based on the material, the cleaning instruction, the number of times that the mask can be washed, and how do you wash it, and the methods. We all know different clothes have different way of washing. So depending on the material, So those things should also be clear. And also, it should have somewhere that the mask is not a surgical mask. This is very key. It should state clearly that this is not a surgical mask. All this information, if you cannot, if they're bulky, you can have just a pictogram, and show them all how to put the barrier marks in place, maybe substituted instructions, and so on. You can put all that in the pictorial slides and then attach it there, so which are also part of the requirements of the standard. Next, please. Now, in accordance with the standard, there are ways that you need to put the marks on. There are ways that you need to remove the marks. So to start with, according to the standard, before you put on a mask, you have to wash your hands with soap, water, and running water, or use a detergent solution before handling the mask. For the use of the mask, ensure that it has been properly washed beforehand in accordance with the recommendation of this standards, and it must not be wet or so. It should be completely dry before you start using it. And then you should locate the outside of the mask, the top of the mask. Next. Place the barrier mask on the face with the nose bridge. We realize some masks have nose bridges. However, most of the locally produced masks don't have these nose bridges. So if it doesn't exist, you don't have to bother yourself with it. And you hold the barrier mask on the outside, not the side that touches your face, and pass the elastic strips or fabric ties of the head harness behind the head at either side of the ears without crossing them. Sometimes you see people crossing the strips behind, especially when they're elastics. People are fond of crossing them. That's not an ideal way of putting on the mask. And after putting it on, then you pull the bottom of the barrier mask under the chin to make sure that it covers both the nose, the mouth, and the chin. Next slide. Now, putting on the barrier mask, check that the mask covers the chin properly. Pin the nose bridge if exists with both hands to adjust it over the nose. Check that the barrier mask is correctly positioned. This should be done by checking the ceiling and that there is no breathing discomfort to verify the ceiling cover. Cover the mask with a plastic film, or when inhaling, the mask should be flattened against your face. You can easily test whether all the air that you are breathing through comes from the mask. If the mask properly covers your face, if you put a slight plastic or something, once you try to inhale, because the air is not coming, you are pulling the mask and the mask lies flat on your face. However, do not use plastic bags for this exercise. Next slide. Still putting on the barrier mask. Once adjusted, no longer touch the face mask with the hands. Each time the face mask is touched, the user must wash the hands with soap and water or rub with a hydroalcoholic solution. Meaning, anytime you touch the mask, you should wash your hands. And how many times we see that people have been touching the mask with their bare hands on and off during the day, and the mask has never been changed, neither the hands been washed or rubbed under alcoholic solutions. Next slide. One of the other components is, how do we remove a barrier mask? If wearing a protective glove, it is necessary to first remove them. Wash your hands with soap and water or rub with hydrochloric solution. Remove the barrier mask by holding the back of the rope or elastic strip of the head harness without touching the front part of the barrier mask. Next slide. Place a barrier mask to be thrown away in a specific container as described in the standard. Now, if you use a barrier mask and now you don't want to use the barrier mask again, it should be placed in a separate container. What this is telling us is, treat all barrier masks or used barrier masks as contaminated, and it should be handled in a proper way to minimize cross-contamination. Place a barrier mask to be washed in a specified container as well. And wash your hands with soap and water or rub with hydrochloric solutions when you remove the mask. Next slide. Clean the outside of the specific container with a cleaning product. That's all for the content of the mask. Now I go on to some of the important aspects of the standards. Here, okay, recommendations. What is recommended and what is not recommended? Here, the standard is recommending use entirely constructed fabrics, assembled in 2 or 3 layers of the same fabric or different fabric. Use fabrics allowing air to pass through when breathing. Use fabrics that are sufficiently soft and supple to apply around the face to ensure sealing, proper sealing. Use of fabrics that are not too warm, so that will be irritating you to be removing them all the time. And use fabrics that are smooth or not irritating fabrics. And what is not recommended is do not use light or loosely constructed fabrics so that the mask will be falling down every now and then. Do not make a mask with a single thickness of fabric. Do not use staples when designing or assembling a barrier mask. Do not use fabrics blocking the passage of air when breathing, meaning do not use those with high nylon. Do not use fabrics that are too stiff that would not be appropriate for sealing. Do not use warm fabrics that would make masks difficult to wear. And do not use irritating fabrics that would make masks difficult to wear. And do not make vertical seams along the nose, mouth, and chin because it can be causing itches. That was the final slide on the standard. All that I was saying from the content of the standard, which I feel is worth sharing here. Now I will share with you some of the activities that the Bureau has been doing related to COVID-19. We developed the barrier mask standards. We developed guidelines for the manufacturing of PPEs. And we are also developing a hand sanitizer, alcohol-based specification. It has gone a long way, but it's still yet to be published. And the services that we've been doing some testing and certification of barrier masks. Some of the producers will actually bring the masks here for testing, and we test them in accordance to the standards, and we certify them accordingly. And we also did testing and certification of coveralls, PPEs. If you can remember, some time back, the EU donated some coveralls to the Ministry of Health, which were to be supplied to frontline workers and security personnel. All those ones were tested and certified by the Bureau prior to their supplies. So those are some of the activities that the Bureau has been doing related to COVID-19. Next slide. And now here is engagement with Ministry of Health. The Ministry of Health has been engaged by the Standards Bureau from the onset. We were engaging through the Director of Health Services, and the Director of Health Services was identified to us as a focal point by the Minister of Health, and also subsequent engagements with the peers. We are still made to understand that Dr. Bitey will be our focal point, and we were dealing with him. We have a series of meetings, series of activities together. However, there are a lot of challenges, which some of it we can understand, because the ministry were overwhelmed with activities of the COVID-19, especially now that the cases are increasing. One thing was lacking is barrier masks supplied, especially big suppliers. I think it is necessary that the places that they are doing the masks should be first inspected. what is happening is if everybody just get to the market, you buy your cloth, you go to your tailoring shop, sew the marks and start distributing it, and people are buying and wearing like that. We feel that's not ideal, so we do inspection of the premises where the marks are even being produced first. And one of the activities that we do when we are at the premises, after inspecting the cloth and we're certified, we'll also sensitize the tailors on personal hygiene, which is key. Before you start sewing a mask, you should wash your hands clean with detergents, and the table of the machine that you are using should also be sanitized. And when you finish sewing the masks, where you also pack and assemble them, all that should be sanitized. So it's not a matter of just getting the mask, sewing it in any unhygienic premises or tailoring shop and start distributing it. So these are some of the areas that we are trying to engage the Ministry of Health and see what we can do towards that. Though there are some hinges here and there, but we hope in the long run we'll overcome them. And the testing is also done in accordance to the standards at the Bureau. And upon satisfying with the testing, then we do what we call certification. We have a certification mark that we put in all the marks. It's kind of a stamp sort of, which is showing that this is certified by the TGSB. So if for those that produce in small quantities, what we do, we assess all the marks. And after assessment, before the marks has been distributed, they should be ironed to reduce the or minimize infections to users. And also, the other thing that happened is the certification, if the bulk is, if the supplier is producing in bulk, we just do a random sampling using a scientific sampling formula and collect appropriate samples. And if all those samples tested are fine, then that becomes representative of all other marks. And we just certify all of them and allow them for distribution. The other engagement that we have with the ministry was on this hand sanitizer, alcohol-based. This was a standard that we were developing with ECOWAS, and we were sharing the standard with the ministry in order to have access to the content and to be able to support other people that can that are producing it, and to also add value to the document, because the document was still under the draft stage. And we also shared with the ministry the guidelines for the manufacturing of PPEs. And guess what? All these standards, when they were ready, the first beneficiary is the Minister of Health through Dr. Bitey. One key thing that we also engage the ministry is on calibration of our thermometers. As I said earlier, one of the roles of the Bureau is to conduct calibration services. And now we are using thermometers. We are using the infrared and all other forms of thermometers to be testing people's temperature or patients' temperature. But those equipments at some point need calibration. You cannot be sure that those equipments are all the time giving us the right reading. At some point, you need to test whether they are still is temperature testing. So if our equipment are giving us wrong reading, then we are in a serious trouble. So this is something that we also discussed with the ministry, and we hope something will be done about it, so that we will offer ourselves to recalibrate most of the temperature devices that we are currently using, in order to be certain that whatever temperature it reads is accurate, or else we'll still have more problem, because we will test some people's temperatures and we think they are fine, when actually they have a higher temperature, or they are silently spreading the disease. Next slide, please. Okay. We also engage some other stakeholders. One of the key stakeholders that we engaged was the National Assembly Health Select Committee. They also have copies of all the standards, and we kind of sensitized them, and they were also trying to see how to convince the ministry to have some of these planned activities in place in order for smooth transition, in order for smooth running between MOH and Ministry of Health in terms of standardizing barrier marks. The former coordinator was also contacted, and he also had a copy of the standards and letter of engagement. And some of the, to my surprise, most of the people that utilize the standards are the UN agencies. The UN agencies, most of them are using the standards, and anytime that they have issues, they come back to us, we sit, discuss, table it, and move on. And actually, most of the standards that are produced by the UN agencies, when we test them, we realize that most of them conform to all the specifications of the standard. UTG are also a stakeholder that we engage with, because they were developing or they are producing alcohol-based hand sanitizers. And when we have this, when we started developing this standard, we engaged them, and we were working with them on the standard, and they also have meaningful contributions to the standard, especially Prof. Nyan and his team. We really commend them for that. And MRC too has a lot of contributions to the standards. So that the Health and Safety Division, Dr. Secker and the team, we really thank them a lot for that, and they actually been cooperating. In fact, most of the things that they produced, we sit together and assess them together, and then actually they meet the standards that was required, and all their questions were cleared, and now they are conforming to all the standards as far as we know right now. Other NGOs and civil society groups were also being engaged. They've been approaching us, and we have a lot of things together. And other government ministries and departments, the US and measures, the Ministry of Trade, and so on. Next slide. Still the related activities. What we have been doing with the standard outside the stakeholders is there are a lot of NGOs and civil society groups that were into this. So what they will do, they will come over, and then we will train them based on the specifications of the standards, and they will go and kind of a TOT, and then they will go and sub-train their other people. And once the people that they train started producing, they will start bring back those samples for us for assessment and testing. We really commend those ones for that, and including some enterprises, SMEs, entrepreneurs, and even some individual tailors. We also try to sensitize the general public using the main TV station, which is GRTS, and also thanks to the risk communication team of the Ministry of Health. They've been providing us some slots during their radio programs to discuss about the standards of these marks during their radio airtimes. Next slide. The Bureau has some standards that are actually related to this COVID-19. First is the barrier mark standards. The hand sanitizer is alcohol-based specification. Quality management systems, the requirements. Environmental management systems, requirement with guidance for use. The guidelines for the manufacturing of coveralls, among other standards. So these are all standards that are here and can be accessible if need be. Next slide. So in conclusion, you all agree with me that most of the marks that we see in town are not conforming to the barrier mark standards. And the general public also has limited knowledge on the usage, because sometimes you see a mark, the way that people are using or handling the marks is not proper, But sometimes you don't blame them because some of them don't even know some of the dangers associated with the utilization of the marks and the way they're using the marks. So I think there's limited knowledge on the usage of this or handling of these marks. Next slide. So I think so what I'm recommending here is we need an advocacy for usage of certified barrier marks, sensitization of the general public on the barrier mark standards through radios, TV, social media, and other appropriate mediums. Major producers of barrier marks, especially for mass distribution, should undergo proper testing and certification prior to distribution. And calibration and recalibration of all clinical or medical thermometers, I think is definitely necessary right now because we are using these temperatures as our first line even before conducting some of the tests. So in a short note, I think that this is what I have for you from the Gambia Standards Bureau. I thank you all for your attention.
Thank you very much, Mr. Ibrahim S.O. Jallo, for that very wonderful presentation. At this moment, we would invite questions, comments, and contributions. Sir Silla, can you go through the questions if there are any?
Thank you very much, Lum. Thank you very much, Mr. Jallo. That was a very beautiful presentation. So we have some questions on the chat box. The first question is coming from Sanget. Is your measurement standards, or in your measurement standards, which country standard are you planning to use, or you have the technical expertise to create your own standards?
Thank you very much. I'll be grateful if Musa can elaborate more on that question. I'm seeing the question here, but I find it difficult to understand which angle is he asking from and what did he mean.
Musa, please go ahead.
Okay, thank you very much, Mr. Ibrahima. On your first slide, you were talking about the measurement standard that you're coming up with. So before you come up with a measurement standard, there must be a platform on established measure. So what measurements are you trying to come up with, or do you want to adopt measurements from other countries to use it in this country?
Okay, thank you very much, Musa. Actually, the measurement standards that we refer in here is basically the SI units. And the SI units are internationally recognized. And those are the same SI units that we're referring to. However, what I was actually referring there was in the Gambia, if you look at most of our business entities, they are not using a standardized measurement system. For example, if you go to a market, for example, you want tomatoes, they just do a sum for you. And you can go to another supplier, another seller, and you realize it's more. So what we are trying to encourage is to start using per kilos, so that the buyer is not losing, neither the seller losing. Because if you buy, for example, a bucket of tomatoes and you know how many kilos are in it, and you know how much you bought it for, so when you come to sell, you get back what you desire. The reason why we are trying to avoid is when you are packing fruits or other kind of vegetables in a container, it depends, the quantity in the container depends on how you pack them. So in most cases, we realize that's where middlemen cheat either the producers or the consumers. That's what we're trying to do.
All right. Is that all? All right. Yeah, so the next question is coming from Mohammed. What fundamental references do you use to compare your standards? Do you have created references or reference that are in place for every item, or what?
Yes, thank you very much. This is why I was trying to be very brief in trying to highlight the Bureau's activities. But standard development procedure has a lot in it. So there are international standard development procedures that one needs to follow. If I were to do that presentation here, I'm afraid a lot of people will log out and leave us here. But to be summarized, there are standard development procedures that you follow to develop any kind of standard. And in development standards, there are different ways. One, you can adopt international standards because we have rights and access to all international standards because we are members of most of the international standards, standardization bodies. And we also have a regional standardizing body, ECOSHAN, from ECOWAS. So we can adopt international standards. We can not direct, not actually, it may be direct adoption, it may be adoption with changes. We can initiate a reference standard, and through research, we can finalize its development, like we did for some standards already. And there's also a way you participate in the development of standard internationally. Like I was saying in this, in the hand sanitizer, the Gambia is participating in the development of the standard internationally. ECOWAS is the one developing the standard, so we are participating in the development process. And we also participate in the development of standard from ISO, international, having a mirror committee here. So there are different ways and procedures of getting standards in place. So there are international standards procedures that we follow. So if I want to explain that here, I think we'll consume all the time. But there are standard procedures that we should follow in short. Thank you.
All right, so we have a long one coming from Boubacar Diallo, quite a long one, but I will read. With regards to the barrier mask, since they are not subjected to any form of conformity testing and discretionary to the manufacturer, how would the Bureau ensure quality and uniform adherence to the minimum standards? Are there any research conducted to establish the effectiveness of these barriers in relation to the brands or types currently used by the public in our communities?
Thank you very much, Mr. Diallo. That question is a very good question. However, because of this question, this is why we were constantly engaging the Ministry of Health. Because as per our mandate, we are not a regulatory institution. So we cannot regulate, we cannot go to the market and regulate the use of the marks. However, it is our responsibility to develop the standards and they are available. So these were the areas that we wanted to engage the Ministry of Health, so that it was even going to be part of this pronouncement that anybody that is selling marks, you should make sure that the marks have been certified by the Bureau. And what other enterprises and other NGOs have been doing before they embark on mass production, from the time that they bought the cloth, that's the time they come and with samples, and we can give them the one that meets the specification, and also train them on how to do the cuttings, the design, and so on. So once they go, they produce sample, they come back to us. And you assess the sample. If you are fine, then they go ahead with mass production. That's what we have done. But the Bureau, the Standards Bureau, has no powers to go around, to go to the market and start confiscating or telling people that this is wrong, this is wrong. No, that's not our mandate, because we are not a regulator. So this was the area that we are actually trying to engage the Ministry of Health, because after all, if the marks are not properly used or the standards, the problem becomes a health burden, and the Ministry of Health will bear the chunk of this share.
Well, I was just also going to say it's not your responsibility to regulate. But then I'll have that question, maybe if nobody asks that question, because I think there's a gap. But then there is also some yelp on the question, continuing it. Briefly highlight how the reference values of the Bureau are formulated, considering the need for localization or to suit our local realities. Do we adopt international reference values at all times, even in our local context?
Okay. We do not always adopt reference values. However, sometimes there is a need to adopt reference values, because what happens is, whatever you do in the Gambia regarding standardization, note that you may affect people that are moving in and out, you may affect services, and you may affect goods and services. So if there are good standards within the sub-region, you rather adopt them in order to enhance For example, if you are going to the business sector, in order to pave the way for businesses in the Gambia to access international markets, because if you have your own standard here, yes, they can meet the standard here, but how about if they want to export? It becomes a problem. So this is why, in most cases, we participate in the development of international standards, and once the standard is finally published, then we are part of the people that develop the standard, so we just adopt the standards.
Another one. Okay.
Okay, continue.
All right. So another one coming from, because of time, so I will just quickly say this. Another one coming from Game is, the question is, given that wearing a face mask is mandatory in Gambia, availability and affordability to many may be a challenge, and this may trigger some people to invent their own mask, or perhaps some other people also be tempted to commercialize locally produced mask. Now, what is the Gambia Standard Bureau doing to ensure that someone right there in Fulabanta uses optimum material for his or her locally produced mask?
I thank you first for the question, but the role of the Gambia Standards Bureau here is limited. However, this question should have gone to the Minister of Health. However, the role of the Bureau here is only to give information, sensitization. We are not a regulator, and we don't have power.
I think the Minister of Health will also refer people back to you. I think that's going to
be... Omar, I think it's important that we make a distinction between a mandatory standard and a voluntary standard. In my understanding of this standard, this barrier mark standard, it seems to be voluntary. In this case, there is very little regulatory power that the Standards Bureau can do other than to sensitize people to know the right standards. If it were a mandatory standard, for example, he mentioned about the drinking water standards, those ones, they would have the authority to say you do not meet the standards, then you have to close. In most countries, when you come to standards, there is a voluntary standard which businesses, individuals, public institutions will choose to adopt. They choose to adopt if they want to do so. But it is not mandatory on them. But then you have mandatory standards, which are obviously, like the name implies, they are mandatory. Under no circumstance will you fail with those standards. I think from my own understanding, this barrier mask is a voluntary standard. And I think the most that we can do is to get the people to understand what is the best type of mask out in the market, and also to get our tailors and other local people who are making this mask to know the right approach and the right tool. But I think right now for the Ministry of Health, our priority is just to get people wearing masks. In fact, we are struggling with that. So I think the priority now is shifting towards getting people to use a mask, and hopefully in the near future we could say, okay, now this is the type of standards you have to adhere to. But I think the priority would now be, let us use them irrespective of how small they are, or even if the standards are not to that extent. Probably they would offer some degree of protection. But I think, like Uso said, they will have very little mandate in enforcing a voluntary standard. If I got you right.
Yeah, thank you very much for that interjection, Babu Karum. I think he's absolutely right. Yeah.
All right, so I'll do something quickly here then, Sijaro. There's a question coming from Mohammed. I think it's a recording question about your conduct for testing of mask and certification. He's also asking if there's any research conducted to actually check this effectiveness. You want to answer that?
Yes, testing of local marks is just testing them against the specification of the standard. If you go to the standard, there's a special test procedure that you should carry out. And here we also have a scheme, a certifying scheme that we follow at the Bureau in order to certify locally produced marks. So in brief, I think that's the answer I may have for the question. But however, if he can work here, we can put him through the scheme, because of time, I cannot belabor much on that.
All right, so thank you. I think that's last from my end, with the exemption of B-Boy, I think that's Mr. Abgar Boy, who is putting on emphasis of or somebody speaking his mind. He's also talking about the issue of how do we get somebody in Fulabantang actually get to have the standards measured for his commercial business. Loom, back to you. If there's anyone who wants to ask questions, go ahead to unmute your mic and go on a colloquium. Thank you.
All right, thank you very much, Marcilla. I've just been informed that there is a question from someone that says, should children use face masks? I think this question is coming from Sang Fatima Mendy. I believe this is my boss, Sang Mendy. He's asking if children should wear face mask. So, any answers to
Uh,
that?
yes, I think I may not have an answer to that because right now, even at international level, we don't have a standard for for children barrier marks. I'm seeing some literatures which are even exempting children below 12 years of wearing masks, but actually we don't have any standard for children. And since we don't have any standard, we cannot say children should wear a barrier mask because we don't have much for them. So maybe that is for the Ministry of Health to decide.
Thank you very much, Mr. Jallo. The presentation is very well understood. I think there are key take-home messages, which include the fact that barrier masks are not a substitute for medical masks. This, I am very much concerned with this with regards to the provision of PPE. I've said it in one of the forums, and I'll keep on saying these things. Barrier masks are not to be used in healthcare settings under no circumstances. This becomes all the more important that we are seeing nosocomial infections among our colleagues and our brothers in the front line. We need to re-echo this message to say barrier masks are not a substitute for a standard medical mask. And they are also not a substitute for physical distancing and, of course, proper hand hygiene. Sir Omar would always say that we have lost all our efforts when it comes to physical distancing or social distancing. It's a practice that Gambia did not do very well in. And it's like what we have left is the use of barrier masks and that of hand washing. Hand washing is also slowly going away. And I think it is important for all of us in risk communication and all of us in the front line to keep on re-echoing this message. Mr. Jallo, we thank you very much for having you on the program. And of course, we would always knock on you when should the need arise. And from this point on, we would also want to thank all our keen followers, usual keen followers who are always here with us on the program, and to say keep on watching out for us next week. And there will be, of course, more exciting and interesting content. Until we come your way next week, have a good, pleasant evening.